Hi, I'm Eileen Doherty, Director of the Colorado Gerontological Society. And today I would like to share with you the Senior Savings Model. This is a new program of Medicare to help with the cost of insulin for Medicare beneficiaries. According to the Centers for Disease Control, the sixth leading cause of death in the United States is diabetes among individuals 65 and over. Type 1 diabetes means that the body does not produce enough insulin. Type 2 diabetes means that the body is processing insulin incorrectly. About 20% of people over age 65 have diabetes. People with diabetes are 2 to 4 times more likely to die from cardiovascular disease than those with diabetes. Type 2 diabetes, often called adult onset diabetes, is a common condition that causes the body to have trouble processing complex carbohydrates and sugars. A major function of the pancreas is to produce additional insulin to use sugar or glucose that is produced from food. Many older adults who suffer from diabetes also suffer from other diseases such as kidney failure, coronary artery disease, and stroke. Health problems associated with diabetes include blood vessels not delivering enough blood to the extremities, often resulting in amputations, mild to severe forms of nervous system damage, as well as vision problems such as blindness, cataracts, and glaucoma. Medicare has for a long time been concerned about the high cost of managing diabetes. In response, many of the Medicare Part D plans are now participating in the Senior Savings Model, which is a program to limit out-of-pocket costs for insulin. The cost of insulin is in the thousands of dollars per year for many individuals who pay privately. Even individuals who have Medicare Part D plans often face high cost of insulin because it is often a tier 3, 4, or 5 drug, which requires that the beneficiary pay as much as 50% of the cost of the drug out of pocket. The Senior Savings Model is a voluntary program that prescription drug plans and Medicare Advantage plans, which offer prescription drug benefit, participate in. The Senior Savings Model limits the amount of out-of-pocket expense for a Medicare beneficiary to $35 per vial in Colorado. Most prescription drug plans in Colorado follow the standard prescription drug benefit. And here is where you must be very careful. The prescription drug plan standard benefit requires that the individual pay the first $445 of the cost of retail prescriptions. The beneficiary then pays 25%, or about $3,550 of the next $14,178 in retail charges. This then puts you through the initial coverage gap as well as the donut hole. When the cost of your retail prescriptions reaches $14,178, you have then reached what they call the catastrophic coverage gap. In the catastrophic coverage gap, you are responsible for paying $3.70 for any drugs that cost less than $74 and 5% of the cost for any generic drugs over $74. For name brands, if you are in the catastrophic coverage gap, you will pay $9.20 if the retail cost is under $184, or 5% of the cost of the drugs more than $184. So what does that mean if you are using insulin? We're specifically going to look at this only if insulin is the only drug that you are using. So the average cost of a vial of insulin is about $450. If you need both long-acting and short-acting insulin, the total cost for one vial of each can be as high as $900 without any prescription drug coverage. If you as a Medicare beneficiary purchase only one vial of long-acting and one vial of short-acting insulin each month, you will see a significant savings because you will only have to pay $35 for the long-acting and another $35 for the short-acting insulin each month. However, your savings quickly decreases if you need 2 vials of each monthly, because the way that the product works if you need 2 vials is that the first vial will be $35. The second vial, then you will have to pay full price for, or whatever percentage that you would have to pay if the drug is in whatever tier, 3, 4, 5, whatever. So your savings, while significant if you only have to pay for one vial, it is not nearly as significant if you have to pay for 2 vials of the same drug each month. In choosing a prescription drug benefit, it is important to use the plan finder at Medicare.gov to review your estimated out-of-pocket costs based on your insulin needs. Medicare B also pays for diabetic supplies, such as lancets and test strips, but you again must purchase those at a Part B participating provider. While many beneficiaries will purchase these items at a pharmacy, a grocery store pharmacy is oftentimes not a Part B provider. They are a Part D provider, and you can get your insulin there, but not a Part B provider. Many of the standalone pharmacies, however, are Part B providers. So it's important to check with them to make sure that they will bill Medicare. As Medicare continues to be concerned about the high cost of managing diabetes and the high cost of insulin for beneficiaries who need support through Medicare Part D, they have brought to you the senior savings model. You should also know that diabetes is preventable with a healthy diet, exercise, and optimal weight. November is American Diabetes Month. Treatment for diabetes can include physical activity, a healthy diet, and weight control. For more information on risk factors, prevention, and ways to manage diabetes, visit us at www.senioranswers.org. I look forward to talking with you in the future.